So today we're going to do the paranasal sinuses. We have 4 projections. The first one we're going to do is the Caldwell. It's a PA projection, and then we have a 15-degree tube angle. So your patient is going to be positioned in a PA projection, the same kind of projection as we've had in the past. And I've detented my tube here. I'll have you turn and face the board. It's been doing that. And I'm turning my light on here. And I need you real close. We're going to use the orbital meatal line to be perpendicular to the IR. So go ahead and tuck your chin a little bit. And I get my straight edge here. And demonstrate that line. So tuck just a hair. There you go. Okay. Then I'm going to center my central ray. We have a 10 by 12 IR lengthwise. And I'm going to center my central ray to the nasion. And then it will go here to the center of the IR. So I'm going to move this down just a little bit to match that. And I'm going to put a right marker on this. She's shielded. Now I'm going to step here and double check her positioning. She wouldn't have her hair up in a bun like that. It's okay for this particular projection because it's out of the way. So we're just going to leave it. Collimate in a little bit. I do have to adjust my 40 inches still, so I'm going to readjust just a little bit here. And make sure I have enough light open. And I would leave her alone. That's a Caldwell. Okay, if you've looked at some of the other videos, you've seen a Waters projection already, but we're going to show you another one. The Waters projection is the mentomeatal line, which is from the EAM to the mentum. So I'm going to have you stretch your chin out just a little bit, not too far. Step forward a little bit. Be comfortable. When a patient is in this position, they should not be extending their neck a lot to where it looks stressed or feels stressed for the patient. So if you do happen to see that look, that means you probably have her too steep. So with our mentomeatal line, we go from the EAM, bring your chin up just a little more, right there. Okay. And my central ray should go to the acanthion, just below the nose. And I'm going to adjust my IR to that level. We're going to put a right marker on there. Do a little adjusting here for her position. All of these projections can be done on the table except the Waters. The Waters, as I explained before, and I would leave her just like that. As I explained before, the Waters should be done upright to see the fluid and air levels in the sinus area. Others can be done on the table. Okay, this one is the SMV. Relax for just a minute. We want to kind of set this up ahead of time at the wall. This one is difficult to do on the table. Much better at the wall. I did it in one of the other series for you, but we'll show you one more time here. I have shielding on my patient, left marker. My cassette is lengthwise in the IR in the bucky, and I'm going to have her bend her head all the way back so the vertex is touching the board. We try to do this very quickly, so it may take a couple times in between where you let them relax and then try again. So I want the vertex touching. I want her head nice and straight. The only way you can see that is by looking right straight behind, from behind where the tube is. And I think she's nice and straight. I want my central ray to enter just above the EM, about 1 inch. And then I'm going to center my IR to that. If you need to move the bucky, you need to warn your patient and then just move it as needed very quickly and easily. And the central ray enters about an inch above the EAM, and the IOML should be parallel to the IR, so I'll show you that. Bring your head back just a little more. There, so this line is parallel to the IR. And that's it for the SMV. The next projection is the lateral. I have my patient set up for that. She's got shielding on. We have our left marker. Our central ray is positioned about an inch posterior to the outer canthus. And the reason we do that is because we want to make sure to include the sphenoid sinuses that are toward the center of the head. We have it positioned correctly for you, and the other part is that the interpupillary line should be perpendicular to the IR. That means her eyes should be on the same level. And then the infraorbital meatal line, make sure that's nice and straight. Yes. So that would be the lateral.